Well, hey guys, I'm Dr. Ben, founder of Well Health and Chiropractic, and this is a video on what is the difference between chiropractic care and physical therapy. This is the lowdown, so here we go. First and foremost, chiropractic care and physical therapy are things that are really hand in hand, in my opinion. You know, sometimes there's chiropractors that hate physical therapists and physical therapists that hate chiropractors, and that's really dumb because we do two very, very different things. Let me show you. Come on with me. So a chiropractor, for the most part, is all about moving vertebra and unpinching nerves, right? So in this chart, chiropractors focus on where do the nerves go, which organs are these nerves going to, and when your vertebrae are in the wrong position, how do we move them into the correct position? Because really how this works, a lot of people don't realize, is when your vertebrae are lined up perfectly, there will be no pressure and pinches on your spinal cord at the spinal level. The vertebrae shift out of position. Now we put pressure on the nerve, which can cause pain. It can also, research actually shows that the weight of a dime on a spinal nerve can shut down 50% function to an organ. So it's a really big deal. So chiropractors really focus on moving the vertebra and then rehabbing the muscles, ligaments, and tendons so that the vertebrae stay in the correct position. Now, physical therapists, generally speaking, are going to be working more on the soft tissues. So this is going to be rehab things, like you've sprained your ankle and we need to strengthen it back up. Maybe you have come out of a shoulder surgery and you're trying to get the motion back in your arm and the stability back in your shoulder and your rotator cuff. Listen, that is a physical therapy thing all day long. And yes, some of our things will, our paths will cross on low back pain. Hey, listen, if your low back pain is caused by just a weak low back, well, that's one thing. But if your vertebrae are out of position, that's another thing. And physical therapy isn't designed to put, or doesn't specifically work on moving the vertebra back in the right position. Now, I think it's an interesting thing because a lot of times we find that physical therapists try to do chiropractic stuff and sometimes chiropractors are trying to do physical therapist stuff. Personally, I feel that it is a best solution to try to, and a best practice for a patient to try to find a chiropractor who is amazing at adjusting. Like we do at Well Health and Chiropractic, we focus on our corrective adjustments. And when you want to go to a physical therapist, go to the best physical therapist that knows how to strengthen, rehab, and really get you more stable in your joint, feeling better, and pushing you but not pushing you too hard. Because the reality is when it comes to moving vertebra, in a chiropractic word, we call this a chiropractic adjustment. In the physical therapy world, they call this a grade 5 mobility. The education is completely different. To be a chiropractor, listen, I've adjusted 500,000 people. And honestly, in school, we spent years really working on the art of adjustments. Where in physical therapy, to do grade 5 mobility, that's really like a class you take in school. And I know that it can be a little bit more than that. However, there's no question that when we pop a back, when we adjust a vertebra, you want that to be done by a chiropractor. And for the same reason, if you're coming off a shoulder surgery, me personally, I had a knee surgery a while back, and I went to a physical therapist because they restabilized my knee, and I'm not going to go to a chiropractor for that. Personally, that's what I did. Anyways, guys, I'm Dr. Ben. Hopefully that helps you to understand the differences between a chiropractor and a physical therapy. So if you are looking for a chiropractor, make sure that you click below and take advantage of our new patient special so we can connect you with a well office that specializes in powerful, corrective, and gentle chiropractic adjustments. I really hope that we see you soon, guys. I'm Dr. Ben, and this is the lowdown on chiropractic versus physical therapy.